I think palliative care is not about end-of-life care. It's also not about giving up, but it's about really attending to what's important to the person, also attending to the symptoms that may be affecting the comfort and the quality of life of the person. We can't relieve all symptoms, but if he's still alert, sentient, and able to express his wishes, then a big part of dignity has to do with being able to express our freedom. And as they live longer, they also live with chronic illnesses. And these chronic illnesses are largely incurable. And these illnesses could include heart failure, kidney failure, organ failures. They could also include brain failure, such as dementia. And so when a person lives for many years with these illnesses, which are not curable, then I think palliative care becomes very relevant, because the goals of palliative care are to maintain a reasonable quality of life so that the person can continue to live life meaningfully and purposefully in spite of these illnesses. So people might think or misconstrue that when the person is offered palliative care, or a patient is offered palliative care, it means that all curative intents will be stopped. But that's not the case actually. So for example, a person with dementia can have poor feeding, right? It does not mean that if a person with dementia who eats poorly will be just allowed to continue to languish in that way. One could still offer tube feeding if appropriate. Why not? So as long as it's something that we do to uphold a quality of life, maintain the dignity of the person, the wishes of the person, and maybe the family members, then it is still compatible with good palliative care. So basically valuing every person, knowing the unique profile of each person, being able to empathize with the person, stand in the person's shoes. And sometimes, say for a person with diabetes, right? He may have very poorly controlled diabetes because he's apparently non-compliant to lifestyle measures and medication. That may be because to him, he is not what's most important to him at this point in his life. He may be actively pursuing work because he needs to make ends meet to meet the needs of the family. So if we actually go from that angle and help him in fulfilling what matters to him, and help him see that if he controls his illness well, then he will be better able to fulfill those desires he has and align the treatment to what is most important to him. So I think it's in this way that palliative care being person-centered, person-focused, and attending to what's important to people first, and not just attend to the diabetes and chase after the numbers, getting the sugar levels down. Palliative care can be applicable to all illnesses. It's active pursuit of what really matters to the person.